There are hospitals in Colorado scrambling how to figure out how to keep their doors open. Budgets are that tight. It means sometimes you have patients showing up with no space for them. Arnusha Roy takes us inside Denver Health to show us the tough decisions they're making there and why they're not alone.
In 160 years, the people inside Denver Health have seen ups and downs, but the money problems they face now are tied to unprecedented times.
We've always made it through. And our number one priority is to keep our beds, our hospital, and our clinics open for the patients who need our care.
This is the money drop-off Denver Health is facing. Right now, their rainy day fund would last 86 days. The hospital would like it to be at least 117. The average hospital has around 200 days of cash on hand. It might feel counterintuitive because of the pandemic.
Biggest is the cost of staffing. They're in short supply, and when they do exist, they are extraordinarily expensive.
Since March, the hospital has on average been $3 to $3.5 million over budget a month, paying for contract healthcare workers. It is still such a struggle to find and hire someone full-time, and federal help to cover this cost ended this year. So between the budget, staffing shortages, and making sure patients are properly taken care of,
had to close some of our beds in our hospital because we don't have the staff to be able to take care of the patients in the way we would like to.
Starting August 10th, Denver Health temporarily closed 21 beds, and they've been intermittently making this kind of call over the last few months. And when patients show up and they are out of space, a pandemic familiarity strikes. The patients are sent to other hospitals.
Either the ambulances know ahead of time that, hey, we got a lot of patients waiting, or we have we need to have this ambulance choose elsewhere.
Denver Health is by no means alone. The Colorado Hospital Association said national trends are playing out here, that more than half of all hospitals could be operating in the red this year, and that's the optimistic projection. The association also said hospitals in Colorado saw losses of more than $300 million in the first half of this year.
So the Hospital Association said that they are working through a lot of options, right? Pausing services, closing some departments or locations before having to decide if they close or not. That is the absolute last result. Denver Health does have a lot of patients who are underinsured or have no insurance. They are working on saving money outside of the clinic setting, and as well as increasing the revenue on the clinic side as well. It's really all hands on deck at this point.
It's just kind of unfathomable, the idea that you'd go into a hospital and they'd say there's no room in the inn. It's like, at that point, where are you going?
Yeah, I mean, it's a terrifying prospect, right? And at the height of the pandemic, we were hearing people being taken out of state because we were running out of space. Now, what we're hearing from Denver Health is that their goal is to keep people in the Denver area, at least the metro area, but they also can't make that promise, Kyle, because it just depends on where the space is.
I imagine a family member having a tough issue and then they're, out somewhere else.
Yeah, it's awful.
Supposed to be in close to home. Arnusha, thank you.